You remember the last time you sat by the fountain pool, gazing at the black stone monument crowned with the fountain source, and you were throwing few coins into the pool. And with every splash, a new wish crept inside. I really wish health for all, that's the true need of the hour. Now, wiping this coin game scene, let's turn the heads for the topic of the day. It's the absorption via parenteral drug administration routes. Welcome all to Is Pharmacology Difficult podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find, and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. Passive diffusion, it governs the absorption for the drugs given by subcutaneous or intramuscular route. And then the drug enters blood plasma or lymph. Drug deposits almost in proximity of the blood capillaries, which possess large paracellular spaces. Lipid-soluble drugs adopt filtration to pass through, while few large ions too, they gain feasible entry, while very big ions are absorbed through the lymphatics. As far as speed is concerned, absorption via the intramuscular route, it gains the uppermost hand. Guess the reason? I know you know that because muscle tissue is richly supplied by the blood vessels. But if you compare with oral route, both subcutaneous and intramuscular, they are good enough as far as the consistency and predictability of the drug concentration is concerned. Any factor that's gonna increase the blood flow will definitely increase the drug absorption. Now, some good factors are exercise, hot water bottle massage, etc. While in the condition of shock, that is very less perfusion, when the circulation is highly impeded, or administration of the vasoconstrictor along with the drug. One classical example I'm going to give you at this particular moment is the administration of local anesthetic with adrenaline. Now, all these two situations, the shock and the vasoconstrictor along with the LA, that is local anesthetic, in both the conditions, the absorption is hampered. Now I'm going to talk about the depot preparations. Depot preparations of insulin, penicillin, etc. They are easily administered this way. Now the time at this moment, it orders to know the pros and cons of these routes. Subcutaneous. The pros are it's a highly reliable and suitable for self-administration. But then the cons, they too go hand in hand. You just cannot avoid them. Say, sometimes circulatory failure occurs. Then what happens? The absorption is impeded. If you again and again try this route, there may be erratic absorption and there are chances of lipoatrophy. Now let's have a word about the intramuscular route or the injection. It's quite fast due to the rich blood flow in the arm muscles, and that is compared to the muscles in the gluteal region and the thighs. Now let's count the pros of intramuscular injection on our fingers. It's a reliable route. It is apt for irritant drugs. You can easily give depot preparations of oral contraceptive pills, neuroleptics, etc. at quite large time duration intervals. Soluble drugs, they are absorbed within 15 to 30 minutes. But then, I told you the cons, they are unavoidable. You cannot just escape them. Let's get to know them too. You cannot adopt this route for self-administration, and yes, it may hurt sometimes. It's very painful. And one more point of caution is that if the side effects they occur, they are irreversible. Yes, so be careful, be alert while adopting intramuscular route. Well, parenteral is not yet over. How can it be over without talking about intravenous route? Now, why I didn't take it first and I took it as last? Because intravenous route promises a very good absorption and bioavailability, and I have told you all this much before. So, it's better to discuss this route in the end as far as the parenteral routes are concerned. Intravenous bolus, it passes across the bloodstream. Eventually, it is diluted few times and then it targets organs which are rich in blood supply, like organs, brain, heart, liver, and kidney. What are the good things about this route? The good things, they are its rapidity, its effectiveness, its predictability in the blood concentration. You can seize the drug in a fraction of a second if you are observing any sort of adverse effect. Drugs like anti-cancer, they are real good to go by this way. But the unwanted side effects of this route, they are sometimes, well, there's a very good quote, haste leads to hazard. And that goes very well as far as intravenous route is concerned. Why I'm saying like that? Because rapid rise in plasma drug concentration, it sometimes outpaces the distribution and elimination. That's a real dangerous situation. Then there are great chances of local venous thrombosis, as this is many a time seen with irritant drug formulations like those of diazepam. Then infusion, if it's done in small veins, then it also may lead to such consequences. And lastly, extravasation, it hurts so much and it's really very harmful. Now that was all my description about the parenteral routes of drug administration, and as far as absorption is concerned, I discussed all the pros and cons of these routes. I just want to ask you before I depart today, are there few coins left by the late evening to splash with a wish in your virtual pool? I tell you, a very good advice I want to give to all of you is never run out of these coins. Because you can always wish for the harmony, peace, health, and good for all, endlessly and infinitely. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about medicinal sciences, drug information, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name as Pharmacology Difficult. If you are listening for the first time, do follow me here, whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Yes, did you attend the Apple event last night? Are you amazed at all the changes they made for us? Well, I'm so amazed and really waiting for them to really go through from the May. Stay safe, stay happy, stay enlightened. Thank you.